Everyone, welcome to this 2 to 2 live stream. I'm Liz and I'm joined by Charlotte.
Hi.
This evening we're doing your NCFE T-Level Health Paper B exam warm-up. Hopefully a lot of you know how this works and you would have joined us last night. Basically we'll run through some activities linked to the themes in the paper. If you type your answers in the chat, we will try and read some of those out. We hope that your paper A went okay today. But let's focus now on the science bit, paper B, exam happening next week. So let's go for it. So body systems 1 is section A of your paper. So this could be questions on cardiovascular system, respiratory system, nervous system, musculoskeletal system, plus your core concepts from B1 and perhaps cancer as well. Okay, so those are the kind of areas we're looking at. And our first activity is a give me 4. I'll start us off with this one. So we're going to give you 30 seconds on the clock to give us 4 organelles that are found within eukaryotic cells. So we're going to give you a 30-second timer. Type your answers in the chat. It doesn't matter if you don't know 4, give us 1, 2, 3, however many you can. Let's go.
That's very quick.
Very quick. Great answers from Gemma, Lively, Bernice, April. Hi April, I recognise you from last night. Well done for coming back. Fadina, hi again as well.
Gemma was on last night as well. I think Lively was on too.
Brilliant. 5 more seconds, guys. Okay, lots of great answers there. Let's have a look at ours. I think you'll find they are very similar to yours. Nucleus, mitochondria, ribosomes and Golgi apparatus. Some of you guys have given us lysosomes. Excellent. Smooth endoplasmic reticulum, rough endoplasmic reticulum. Someone said cytoplasm. Cytoplasm isn't an organelle. That's kind of like the matrix, like the fluid within the cell in which the organelles float. Okay, so if you do get a question like that, oh, there's a pussycat. If you do get a question like that, remember cytoplasm is not an organelle. It's the kind of semi-fluid stuff inside. Okay, let's move on. So we've got some multiple choice questions which are all about cells. So Charlotte, maybe if you just read the question and then we'll see what answers we get.
Yeah, so what I'll do is I'll read out the question, and all you need to do is put A, B, C, or D in the chat. So the first one: controls the passage of substances into and out of the cell and is the site of antigens. So I think we've got a unanimous answer there.
Mm-hmm. Excellent, well done, guys. It is your cell surface membrane. Okay,
Well
number
done.
2, Charlotte.
So this organelle is involved with the separation of chromosomes during cell division. Is that A, B, C, or D?
Brilliant, I can see answers coming through. They're all going to whiz on your screen in a sec, Charlotte.
Yeah, well done, everyone.
Yep, centrioles, you are correct. And number 3.
This organelle's primary function is to synthesize proteins. Is that A, B, C, or D?
Remember the clue is in the picture as well, guys. Yep, lots of correct answers coming through. I think everyone's correct, pretty much.
Well done.
Yep, rough endoplasmic reticulum, quite possibly the best name on the planet. Okay, number 4.
Site of respiration producing ATP. I'll let you say that out loud.
Adenosine triphosphate.
That's the one. Is that A, B, C, or D?
And it looks to me like everyone's getting this one correct as well. Brilliant. That is the mitochondria. Fantastic work, guys. Okay, so now we're going to do a 60-second challenge. If you joined us last night, you know how these work. We're going to give you a set of key terms and a set of definitions, and we want you to match them. So just give us the letter with the matched number. This is quite an easy one, so I expect you're going to be really quick at this. 60 seconds on the clock. Off you go. Okay, I actually was really quick on the draw there, Charlotte, and I favourited some correct answers. So I'll reveal them and then I'll give some shout outs to some specific people. So Khadija was super quick, telling us that body system A matches to number 4, a group of organs working together to perform specific functions essential for health and survival. Jai was very quick to tell us that C, respiratory system, is about facilitating gas exchange, bringing oxygen into the body, removing carbon dioxide through the lungs. Then I saw Abby give us B3, cardiovascular system, transports oxygen, nutrients and waste products throughout the body via the heart and blood vessels. Gemma was very quick to give us all 4, but let's look at D, nervous system, links to 1, controls body functions and responses by transmitting signals between brain, spinal cord and nerves. And then Bernice said E5, musculoskeletal system, supports movement, protects organs, maintains posture through muscles, bones and joints. Fabulous.
Well done.
Okay, So, Charlotte, do you want to explain this fun activity now?
Yeah, so this one we've got a picture and we've got a phrase, or it might be a word or a sentence, and you need to smash those together and see what you come up with. So what we'll do is this first one we will give you as an example. So this one, if anybody can tell us straight away, we'll give you this one straight away. We've got somebody saying pressure. We'll reveal this one as an example.
Oh, Milo and Abby and Ryan just came in saying blood pressure. Yes. So this is how it works.
Yeah.
Brilliant work.
This is how it works. So let's have a look at the next one then. So look at the picture and look at the phrase we've got and see if you can figure out what we're trying to say.
Okay, Jemima was straight in with heart rate there. I think you were the first, Jemima. Well done.
Well done.
Excellent.
Oh, we have Ryan back as well. I hope he talked about SOPs this afternoon.
Yeah, I hope you got SOPs into your answers, Ryan. Here's another
And
one.
again, what have we got this time? One marker on SOPs. Well, at least you know you've definitely got that one mark.
Oh, April says there's a question that was about a definition of it. Oh, okay.
Oh, amazing.
Good.
Amazing.
I hope everyone got that one mark. Everyone's getting gas exchange. Well done. Brilliant.
Gas exchange, yes, well done. Let's have a look at the next one then. So look at the picture, look at the phrase next to it, and come up with what we've smashed together.
Okay, Jemima said lung volume, not quite. Gemma then said respiratory rate. Very good.
Very good, yeah. Could
Alexia
think of a different word.
Sorry, Alexia is saying that you could include SOPs in your infection prevention question as well. Brilliant, guys.
Oh, amazing.
Yeah, breathing rate, respiration rate. Fabulous. Okay, the big reveal. Do you want to do this one as well, Charlotte?
Yeah, I'll do this one. So, if you were joined us last night, basically we give you some clues and to work out what is behind the question mark at the bottom. So let's have a look then. What have we got? Our first clue then is an autoimmune disease affecting joints. If you can give us an answer straight away, have a go. Second clue then. It causes inflammation, pain and stiffness.
Okay, we've got
I don't think anybody's had a go yet.
Arthritis. It'd be
Okay.
good to have a bit more specific than that. Should we have another clue?
Yeah. So often affects hands, wrists and knees. Let's have a look at number 4.
Got some good answers coming through now.
Symptoms can be managed with physiotherapy. Medication available includes biological and anti-rheumatic drugs. So what is our answer? It is rheumatoid arthritis. Well done.
Yeah,
for those of you that put that.
guys. Be really specific with that one because arthritis does include osteoarthritis, which is normal wear and tear with aging of your joints. Rheumatoid arthritis is different. It is an autoimmune condition. It can affect you in childhood, for example. Osteoarthritis generally happens quite later on in life. Brilliant work. Okay, I shall read you these clues. Are we ready, guys? A genetic disorder causing muscle weakness. Clue 2, progressively worsens over time, affecting movement. Any guesses yet, guys?
We've got MD so far.
Yeah, brilliant. Number 3, impacts the muscles used for walking and breathing. So this can affect someone's ability to breathe. Remember, your intercostal muscles and your diaphragm are heavily involved in breathing. Number 4, quality of life can be improved with physiotherapy and low impact exercise. And then final clue, treatments include steroids and surgery. And yes, you guys.
A lot of our answers are muscular dystrophy. Well done.
Brilliant. Okay. Charlotte, do you want to explain this one?
Yeah, so on this one, we're going to give you 60 seconds, and what you need to do is put the correct, correct symptom, or correct treatment, under the correct health condition. So what we can do is you could say coronary heart disease and then look at what numbers would come after that one if you want to write it in the chat.
Okay.
Off you go. So we've got different treatments, we've got different phrases or something that describes, something that causes each condition.
Okay, Charlotte,
Well
I
done.
have favorited some correct answers. So Jemima
Okay.
says coronary heart disease is number 3, treated with statins. Number 5,
Yeah.
stents can improve blood flow. And number 6, caused by artery blockages. That's correct, Jemima, well done.
Well done.
Aluka says Parkinson's disease relates to number 2, causes tremors and stiffness, and number 8, managed with dopamine. And Abby said COPD, chronic obstructive pulmonary disease, is linked to managed with inhalers, pulmonary rehab aids breathing, and linked to smoking. And lots of other people got it correct as well.
Well done.
Just reveal for you guys. So make sure that you know some of the key causes, symptoms and treatments for all these conditions. And then in terms of the treatment, some positives and negatives, or when a particular treatment might be more suitable than another. Okay, let's have a look at our next. So now we're going to move on to section B. So the body systems that could be involved in section B is digestive, renal, integumentary, reproductive and endocrine. And again, you could have some of your core science concepts in there from B1 and possibly cancer as well. So our first activity, over to you, Charlotte, for this one.
Yeah, so you are going to be given 2 minutes and you are going to be given 5 different questions. And then when we pop these up, you'll see that you have to give us 5 of something, 4 of something else, 3 of something else, 2 of something else, and 1 of something else. So you've got 2 minutes on the clock. As soon as you see these, you can start writing them in the chat. Even if you can only give us 4 functions of the of the digestive system, you can only give us 1 component of the renal system. Have a go. And you can have some jazzy music to go along with it.
4,
It's my favourite music, this is.
3, 2, 1.
Benisa started us off. Thank you very much. Welcome back, good diamonds. I hope the paper went well for you today. Well done to those of you giving us all the answers that you can think of.
Well done, yeah. Doing amazing, because some of these as well are really difficult spelling. I'm impressed.
I like activities like this. It proves to you how much you do actually know.
Mm-hmm.
Five, 4, 3, 2, 1.
I think, Charlotte, that every single answer that we've been given has been accurate. So well
Oh,
done,
well
everyone.
done.
So I'll reveal if you want to talk through each of the answers, Charlotte. So first
Yeah,
one.
let's have a look. So our five structures are in the digestive system: our esophagus, stomach, pancreas, liver, and colon. So check your answers, and well done if you got them all correct.
There are other structures as well that I've seen people talking about, so well done. Next one.
We have got glands of the endocrine system, and again, there are more than these, but these are the ones that we've got. The hypothalamus, the pituitary, the thyroid, and your adrenals.
Brilliant. I've seen lots of those mentioned.
Components of the renal system: kidneys, ureters, and bladder.
Yep, definitely had those.
Functions of the reproductive system. So we've got to produce and deposit sperm, which is in males, and produce eggs and nourish offspring in females.
Yep, we had similar things to that in the chat, so well done. And finally,
And one function of the integumentary system, pat myself on the back with that one,
yeah,
is protection. So
yeah.
that's our skin.
There's lots of functions for that one, but that protection is one of the most important or easy to remember as well. So well done, guys. Brilliant work. Okay, so give me 4. You know how this works. I want 4 examples of how a pathogen can enter the body through direct transmission. So let's try and be as accurate as we can and just focus on direct transmission. So off you go.
Some more jazzy music.
Okay, so the answers that I'm going to show you are straight off the specification, okay? So we have got skin to skin contact. So Khadija said physical contact with infected individuals. Someone else said through contact with an infected patient. Yep, just make sure you're as specific as you can. So direct transmission is through skin to skin contact. You could have a pathogen enter your body through the sharing of needles. No one has written that one, but that one is a possibility. But someone did say something somewhere about contaminated equipment, which you could have a contaminated needle. Unprotected sexual intercourse is another way that direct transmission of pathogens occurs. And then quite a few people have said about inhaling infected droplets. So well done, guys. Good work. Charlotte, over to you for this one.
So we've done this one before again. So 30 seconds on the clock and 4 treatments for cancer.
Well done, Gemma. Well done, Ryan. Get 3 in.
Even if you can't give us 4, just give it a go.
So we've had all the straightforward ones. Okay. Well done, Abby and Jemima. And Khadija have all given us less common ones. Okay. Let's reveal the answers, Charlotte.
So, I think most people went straight ahead with chemotherapy, radiotherapy, I can't say that word, Liz, do you want to give us a go?
Monoclonal antibody therapy.
Okay, this is more targeted immune treatment, and then we've got surgery as well. So well done, Neme, well done, you've said that one.
Yep. Also, thyroidectomy. So that's the specific surgery to remove a thyroid. Well done, Bernice. That's an excellent answer. There's another one that I saw. Oh, yeah, radioactive iodine treatment. Yep, that's one we don't have on there. And there was another one that I saw, and it's flown. Oh, and Milo said about talking therapies. So
yeah, that was good.
I would say just be careful with talking therapy because arguably it's not a treatment, it's like a supportive kind of...
Yeah, it's not a treatment for the cancer, it's a treatment for the
Yeah.
mental health that goes
Yeah.
alongside, isn't it?
Yeah.
Yeah.
Okay, brilliant. So let us move on to the next one. So we've done this one already. This time we've got different categories. So categories are type 1 diabetes, type 2 diabetes, and gestational diabetes. Then we've got some statements or facts about those types of diabetes. You need to sort them into those three. So write T1 and give us the numbers, T2 and give us the numbers, GD and give us the numbers. Off you go.
So we've got different treatments, we've got different causes, we've got different statements. Good answers, well done.
Okay guys, I'm going to go ahead and reveal the answers and then talk you through them. So type 1 diabetes is an autoimmune disease, so the body attacks itself and destroys some of those cells in the pancreas that produce insulin. So in type 1 diabetes you have little or no insulin. It's usually diagnosed in childhood because it normally occurs in childhood, and it does require insulin injections because your body can never produce enough or any at all. Type 2 diabetes is it is linked to obesity, but it's not necessarily caused by obesity. So what it is it's increased insulin resistance, so the insulin doesn't work as well in the body. It can be controlled by lifestyle state changes, but that takes quite a lot of commitment, eating the right foods, exercising regularly. So if that doesn't work, you can use a medication called metformin. And occasionally, actually, type 2 diabetics take insulin as well if the metformin doesn't work. And then you've got gestational diabetes. So gestation is like, being pregnant. So this occurs in pregnancy. It usually resolves after birth, but not always. So sometimes women that have gestational diabetes then go on to have type 2 diabetes afterwards. So well done, everyone. Over to you, Charlotte.
So we've done these ones at the beginning of the session as well. So I'm going to ask a question and all you then need to do is tell us if the answer is A, B, C or D. So which important function does the skin perform? Is that A, B, C or D?
I think Abby was quick, April quick as well. Yep, brilliant guys.
Great stuff, well done. We'll move on to our next one. What is the main function of the kidneys? Is that A, B, C or D?
Yep, so Jemima, Gemma, Aluka, Ryan, Neme, Abby, all saying D.
Amazing, well done. What is the main function of the endocrine system? Is that A, B, C or D? Well done.
So Fadina, Good Diamonds, Gemma, Jemima, Ryan, Abby, all saying D.
Yeah, amazing work, well done. Homeostasis helps the body to what? Is that A, B, C or D?
Okay, Jemima, Alexia, Ryan, Chloe, Abby, Gemma, Fadina, Aluka, all saying A.
Yeah, stay in balance, well done. Let's have a look at number 5. Which treatment is commonly used for eczema? A, B, C, or D?
Everyone's saying A. Bonus, guys, if you can tell me what A means. What is an emollient? You are correct, but what is it? See how fast they are at typing. Fadina says creams, yep. Jemima says softening. Chloe says it's a cream. Yep. It's quite a heavy cream, like a barrier cream. So, yeah. Milo says an aqueous cream, it moisturises the skin. Beautiful answers. Well done, guys.
If you were with us, you could have got a sticker. Never mind.
Yeah.
We love giving stickers out.
Unfortunately, we can't, no.
Crohn's disease mainly affects which system? A, B, C, or D?
Okay, Jemima, Ryan, April, Chloe, Alexia, Fadina, Khadija, Luca, Milo, Gemma, all saying C, digestive system. Abby wants a sticker. I'm sorry, Abby, I can't. I need to work out how to give virtual stickers. Maybe there's a way. Ryan said they did their presentation on Crohn's. Amazing. Okay. Next one.
What is a common cause of chronic kidney disease? Is that A, B, C, or D?
Oh, It's Deborah was super fast there.
That was very fast. Well done. Where there's a will, there's a way, Abby says about stickers.
Yeah. Same. Everyone's saying C. Brilliant. Yep. High blood pressure. Question 8.
Which symptom is common in endometriosis? Is that A, B, C, or D?
It's Deborah was very quick. Again. Everyone's saying B.
Well done. Yep, well done. Great work.
Okay, so let's move on to your final section, section C, which is a synoptic section, which means it brings all of your knowledge together. So any of your B1 and B2 content can be tested in combination. So this is kind of like your anything goes section, okay? So we're going to try and bring our knowledge together a little bit with these. So we're going to start with a bubble quiz, and I want you to identify the correct answers. So it could be 0, 1, 2, 3, or 4 correct answers. But I think I'm going to tell you how many answers I'm looking for. Yeah. So my first question, identify 2 ways that the nervous and the musculoskeletal systems work together. So I want 2 letters. Is it A and B? Is it B and C? Is it A and C? Which are ways that those 2 systems work together?
Try your best. If you can only give us 1, that's fine. Try your best to do 2.
I think everyone's giving us 2. Brilliant work.
That's the superstars.
Yeah, absolutely. So reflexes cause rapid muscle responses and nerves signal the muscles for movement. So well done, guys. Remember our body system, well, all our body systems work in harmony, okay? So number 2, identify 2 ways that the reproductive and endocrine systems work together. So which 2 statements are ways that those 2 systems work together? Make sure you read them carefully, guys, because there's some red herrings in there. Okay, so Milo, you're correct. Gemma's correct. Abby, Aluka, Khadija. So hormones control sexual traits. So the release of hormones is what matures secondary sexual characteristics, and hormones regulate your menstrual cycle and sperm. So hormones are super important in both the maturation of primary sexual characteristics and the emergence of secondary sexual characteristics. Well done, guys. Okay, so now I want 2 ways that the renal and endocrine systems work together. Make sure you read them carefully. Okay, so Neme, it's Deborah, Abby, Kashanti, Alexia, Milo, Ryan. Yep.
Well done.
So C and D. So hormones control kidney function. So remember, you've got those hormones, aldosterone, for example, and they also regulate fluid balance. So, you know, your antidiuretic hormone and so on. Well done. Okay, so now I want one way, so just one way, that the digestive, cardiovascular, and respiratory systems work together. So 3 systems together do one of those things on there. Which one is it? They all work together for this. Yeah, well done. Jemima, Gemma, April, Ryan. Yeah. So obviously your respiratory system, that's gas exchange, that ensures you get oxygen into your body and carbon dioxide is expelled. Digestive system is how we release the nutrients from the food that we eat, and all of that is transported in our blood around our bodies. Fantastic work. I'm very impressed with you guys. Okay, so one way that the integumentary, I can't say it now, and nervous systems work together. So just one of those. So thinking about our skin and our nervous system, what do they both do together? Okay, lots of people saying C. Someone said A. Okay, this one is actually D. So hair doesn't control body temperature, although I guess you're saying that because whether hair stands up on end or not can release heat. Yeah, but actually the nerves signal your sweat glands to excrete and cool you down. But well done, I can see your reasoning with that one. Okay, how about 2 ways that the cardiovascular and respiratory systems work together? Easier one now.
Have a good read of them. This is our last one.
2 ways, remember, guys. So, Just Gabs, Alexia, Milo. Oh no, Milo's not quite right actually. Jemima. Yep, so it's the circulation of blood and oxygen around the body and the removal of carbon dioxide from the body. So the 2 systems have to work together to do that. If one system fails, then that function fails. Well done, everyone. I think that was a brilliant live stream. Excellent work from all you guys. You've obviously been revising really hard. So Charlotte, do you want to talk us through some last things to think about in this week before their exam?
Of course, and I just want to say well done for those of you that have joined tonight, because it shows commitment after you've sat through 2.5 hour exam paper this afternoon as well, so well done. So get plenty of sleep, make sure you're revising, make sure we've got that active revision going on, we're not just trying to cram information into our heads. Eat brain food, stay hydrated. If your teachers are running preparation sessions, make sure you go to these. They are the experts, they can help you as best that they can, and have a positive mindset. You have got this, and from what we've just seen tonight as well, you definitely have.
Yep,
Lots
definitely.
of good answers.
Well done, everyone. Best of luck. As Charlotte said, revise hard, but don't cram and no panicking, please. You've all got a really good grounding. And yeah, as Fadina says, good luck, stay blessed, and don't stress. Totally agree with you.
I love that.
Good luck, everyone. Thank you so much for joining us. See you again soon. Bye.
Bye. Bye.